Do you sometimes see like patients who have eaten something they're like allergic to? Do they develop hives? Is that kind of like a side effect of some allergic reaction?
Absolutely, yeah. So an allergy depends on how severe it is. It can be as mild as a few hives and then everything is gone.
Mhm.
For that, you can just take an oral antihistamine. But it can be as severe as throat completely closing up, low blood pressure, passing out, trouble breathing, wheezing. That's the anaphylaxis we're talking.
Mhm. Mhm.
Allergic reaction, it's a spectrum from very mild to the most severe, resulting in death.
Mhm. Awesome. All right, we're going to move on to some patient advice and prevention. What general advice do you give for preventing flare-ups or acute episodes of these conditions?
It depends on the condition. So now you're talking about mostly asthma. That's probably the most common condition in our practice that causes acute flare-ups. As I said before, be compliant with medications and make sure you're taking it the right way. Avoid the triggers as much as you can. Your peak flows, dropping numbers is not a good sign.
Mm.
Identify the acute symptoms. Use your rescue inhalers sooner rather than later, and seek help sooner rather than later.
Mm-hmm. Yeah. So, like, if you've been prescribed a medicine, take it even if you're not having symptoms. Just kind of stay
Yeah,
on top of everything. Mm-hmm.
that's called a maintenance therapy for asthma. Inhaled steroids.
Mm-hmm.
This is a lot of patients think, "Oh, I'm doing fine. I don't need to take anything." But the
Yeah.
maintenance inhalers do not work like that. They are not skin inhalers. To control the underlying inflammation, these maintenance inhalers need to be taken every day, no matter what.
Mm-hmm.
The rescue inhalers like albuterol can be used as needed. If you don't have any symptoms, you don't have to take it.
Mm-hmm. And are there any warning signs that should prompt a visit to the ER versus waiting to just go see a specialist?
Again, same symptoms.
Mm-hmm.
If you just have angioedema or anaphylaxis, it's
Mm-hmm.
a medical emergency. It cannot wait for a specialist.
Mm-hmm.
I use that antihistamines or EpiPen and then go to the emergency room.
Mm-hmm.
When do you see a specialist? This is probably decided by your primary care physician.
Mm-hmm.
You do see patients coming in just by word of mouth when the medicines are not working. Your regular over-the-counter medicines are not working, then that's a reason to see the specialist. You want to know what you're allergic to. That's a reason. And kids with eczema, do they have any food allergies? That's a reason to see a specialist.